Would you like to give message to our viewers to inculcate healthy practices?
Yeah, so that is a very important question and very important point. I joined Godrej Hospital way back in 2006. Now I'll be entering the 20th year. And there I had the opportunity to give a talk. Earlier, I gave the similar talk at Reliance Hospital and then at Godrej. And then I given it on multiple platforms. It is on preventive gynecology, and it is a subject which is very close to my heart. Means generally we always teach our children prevention is better than cure, but we hardly follow it.
Right.
At least during the COVID, we are now used to washing our hands, taking those sanitizers, using masks and everything if we have cough. But even in gynecology, prevention is better than cure.
Sure.
So one thing is one has to prevent lot of diseases. Important thing on prevention is vaccination. For all the girls who come to me, or if the mother has come and she has a daughter, I advise them about 2 tests, rubella IgG and a varicella IgG.
Okay.
These are German measles and chickenpox.
Okay.
Why? Because if this IgG is positive, then nothing to worry. If they are negative, then one can give a rubella RVAC vaccine, which is just 50 rupees,
Okay.
or a varicella vaccine, which are 2 doses. Because if this girl is going to be a woman later on, or going to be pregnant, and if in the first 3 months of pregnancy she develops German measles or chickenpox, then we have to sometimes terminate the pregnancy.
Okay.
By these simple vaccines, this problem can be avoided.
Right.
Cervical cancer vaccine is coming in a big way. Cervical cancer, that is the cancer of the mouth or the womb, is diagnosed by screening tests like pap smear
Right.
and confirmed by a cervical biopsy.
Okay.
But this occurs because mostly 95% of these cancers occurs because of a HPV virus called a human papilloma virus.
Okay.
And there are a lot of subtypes of it, of which few are carcinogenic.
Okay.
This virus comes in the woman's womb or the mouth of the womb through a sexual contact
Okay.
from the smegma. The smegma is the part of the secretions below the foreskin of the male organ,
Okay.
and then it goes in the woman's cervix, that is the mouth of the womb.
Okay.
It goes and resides there, and if that strain is carcinogenic, it undergoes changes, and that woman can develop a cervical cancer later on.
Okay.
When we give cervical cancer vaccine, nowadays it is it's soon going to be part of the National Immunization Program, and vaccine has been developed by the Serum Institute.
Okay.
Otherwise, it was earlier by GlaxoSmithKline and Merck. The Merck vaccine is the most famous.
Okay.
So it is virus-like particles which causes antibodies against the human papilloma virus. If it is given to the girl and she develops those antibodies, she will never get that HPV infection,
Right.
and she will reduce a risk of one cancer from her life forever.
Right.
So I personally feel that should be a part of the health screening program.
Okay.
Hemoglobin should be checked because the woman only gets menses and they are losing blood.
Right.
So the anemia part has to be corrected. We should always try to keep it at 12, give healthy foods. We should keep a track on the BMI. We should not allow excess weight gain, reduce the junk food.
Right.
Strengthening exercises are very important. It helps in menopause and sarcopenia later on in life, that is muscle weakness. All the girls, whenever they can, I have 2 daughters and I taught both of them about the safe practices of local hygiene. They should have good ablution techniques because urinary tract infection is very common in girls. Why? Because both the spaces are very near to each other. If they are working, then they are using a common toilet. Indian toilets were safe. Nowadays, everywhere there is a Western toilet
Right.
called commode. And if they sit in that, they have more chance of infection from the thighs. Our teacher, Dr. O.P. Kapoor, we used to attend his lectures at Birla Matoshri in our second MBBS. He used to demonstrate on table, on the stage. When a woman is cleaning her after a toilet, she has to take her hand from ahead to back. Even if they are using this jet spray, it should be from front to behind.
Right.
If it is the other way, then some particles may just go up, and the same bacteria causes severe infection. Because in the males, the organs are widely spaced because of the male organ, but a woman, the urethra is only 4 centimeters. Then if they get recurrent infections and the infection heals, the part of the urethra, that is the pipe between the bladder and the outlet, becomes narrow and causes stricture urethra. It causes retention of urine, and that causes more infection. Commonest cause of elderly age woman is prolapse, where some urine retains, and this infections recurrent can cause urine kidney problems. So this is a very simple technique of local hygiene can prevent this major problem. We have to advise them about the anatomy which I explained. I have the privilege of taking lectures to the school-going girls of 8th standard in the Pawar Public School at Bhandup. My teacher had recommended me to go and take lectures, and we have to make them aware of contraception and safe practices, safe sexual practices, preventing of unwanted pregnancy. If a period is missed, they should report to doctor early, because we can avoid a surgery and give medical abortions, medicines for abortions. Then the different contraceptions have to be known to them, so that they unnecessarily don't go for repeated MTPs. Luckily, with all the programs conducted by our parent or body, that is FOXI, Federation of Obstetrics and Gynecologists of India, so we have now reduced the rate of unwanted pregnancies and MTPs. They should know the importance of antenatal care and prenatal counseling. That folic acid tablet which I told you is a very good supplement. They should see doctor early if they have any gynec problem. Do a pap smear, do a mammography. And even if after menopause they have any symptoms, they should get themselves treated. If they get bleeding after menopause, that usually we see patients, they get heavy bleeding during the age of 45-50. They consult their friends and they say everything is okay, period will go. Period goes, and after 5 years they come with another episode of bleeding. And that time already a malignancy has occurred.
Okay.
This could have been prevented if they came early to a doctor. Any bleeding above age of 40 years requires to be investigated. Nowadays we don't do a blind DNC. As I mentioned, a hysteroscopic guided DNC is important. We can see inside the cavity. We can see any suspicious areas. We can take a biopsy. If the cancer, if the report comes in a pre-cancerous state, that means a complex hyperplasia or a typical hyperplasia, we can give them a removal of the uterus by a simple natural orifice vaginal route, which the surgery takes hardly 1 hour, or a laparoscopy surgery.
Right.
They can recover in 2 days and they can prevent a major cancer in future.